Good morning, Peter Goertz. I'm a psychiatrist. Do you like people telling you what to do? I certainly don't. Paternalism in medicine. Who am I as a doctor to tell people what to do? Medicine, at least in many parts of medicine, is not an exact science. There are a lot of gray areas. Where does poor judgment stop and psychiatric illness start? Difficult thing to discern, in my opinion. So we're talking about patients making decisions for themselves. For example, serious medical decisions. Do they want to stop being on a ventilator? Do they want to refuse dialysis, etc.? Now, it may be reasonable for someone to refuse to be on a ventilator. For example, if they've been told they're never going to come off the ventilator, at least as far as the medical perspective, the likelihood of that is pretty much zero. And they're thinking clearly, they're not psychotic, etc. So it may be reasonable for someone to be asking to be taken off a ventilator. If someone's suicidal, psychotic, demented, that can create a situation where it seems to me to be relatively easy to decide that probably someone who's acutely psychotic or acutely suicidal, seriously demented, all of those people probably are not in a state of mind to refuse necessary medical care, serious medical care, let's say dialysis. However, it's not always that easy to decide whether a patient has the capacity to make their decisions regarding medical care. What brought this up for me is a patient I saw, serious medical problems. She came into the hospital with lab work that to me looked like she could have died. However, she seemed psychologically intact, not seriously depressed, not psychotic, not demented. And ultimately I felt, and she did not want to necessarily go along with what the doctors were recommending, but she was also not totally against it. So she wanted to make her own decisions and get more information. So ultimately my opinion was that she was in a state of mind where she could make her own decisions. My personal opinion, though, was also that what she was doing was quite dangerous. And that certainly can happen. Now, another patient I recall from many years ago had breast cancer, open wound on her breast, and did not want medical treatment. And she was actually on a psychiatric ward, I think maybe for an unrelated issue. Maybe it was partly related. Ultimately, she requested her discharge and went to court in the hospital. That hospital had a court in the hospital, I think once or twice a week. And the judge released her. I testified that I thought she was quite depressed, as far as I recall, and unable to make good decisions regarding her medical care, but the judge let her leave the hospital, recommended that she be discharged. Many people do dangerous things, alcohol, drug use, very poor nutrition, and in general, we have to let them do that. Freedom is a very important thing. However, if they're psychotic, demented, etc., that can create a different situation. Some things we can force people to do in certain situations. Let's say if someone is very psychotic, unable to function, potentially dangerous, in some areas of the country at least, a judge can order medication over a patient's objection. We can arrange for someone to be involuntarily psychiatrically hospitalized, over their objection involuntarily. If we feel they're potentially dangerous to themselves or others, or gravely disabled, unable to care for themselves. So certain things we can force people to do. What can be helpful in the long run is to have a person designated to have medical power of attorney in case someone becomes incapacitated, unable to make their medical decisions. What can help in the long run also regarding people making decisions is for them to get psychiatric treatment or psychotherapy. However, a lot of people may not want mental health help, like the lady I mentioned who had the serious medical problems with the lab work that was very concerning. She did not want mental health help. So we're balancing personal freedom, which is very important, with safety of the person, safety of other people. And that can be a delicate balance and a tricky situation to make decisions in for a doctor. How far do I want to press things? Do I want to really force the issue, force this person to get medical treatment? Or is it not at a level where that person can be forced to get medical treatment? Thank you very much.